August.
Good morning, everyone. Welcome to today's webinar. My name is Emily Makalo. I will be your facilitator for today. I first take this opportunity to thank you for taking time to join in so that we can all learn together one or two things that we may be able to answer you on the less known COVID-19 vaccines, Moderna and Janssen. With us is Dr. Jeremy Gitau. He'll be our speaker for today. Dr. Jeremy Gitau is the CEO of the Safiri Company. It is a concierge company which offers home-based care medical solutions. He's also a recipient of the Uzalendo Award, which is a Head of State Commendation Award that he was given for the good work that he did in 2020 in curbing the COVID-19 pandemic. We also have our sign language interpreter, Diana Saja. Diana, you can wave. Thank you, Diana. She'll be assisting us with the sign language interpretation. This webinar is powered by Brita Milele. Brita Milele is an individual health cover that covers you for life, hence the word Milele. Without further ado, I will welcome Daktari to introduce himself further as we proceed. Karibu, Daktari.
Asante sana, Emily. Hope you can hear me.
Yes, we can.
Yes. Yeah, so thank you for the opportunity. I'm glad to be here and to join in this discussion. It's always a pleasure to share what we've learned and what we've seen around COVID-19. Since now it's been almost 20 months since the disease was found out, and we'll be discussing what we've learned. We'll touch briefly on what we already know, and then we'll look at vaccines, because that's the main topic for today. I don't want to bog you with information that you already know. Yeah, so that's what we'll be talking about today. So next. So we're looking at the updates and the vaccines for today's presentation. As mentioned, so this is what we plan to learn. So we look at what we already know about COVID-19. I like discussing long COVID when I'm talking about COVID nowadays, because this is one of the conditions that we're currently seeing, and it's very common. So it's important people to understand it and to see what it's about. We look at the various variants and how they impact the vaccines and also the disease as a whole. Then we look now specifically at the different vaccines and see how different they are and what makes them different in terms of their presentation. So just as an introduction, as Emily mentioned, we work with Dr. Safiri, which is a concierge medical company comprising of a big team. So we have doctors, clinical officers, nurses. We now have even consultants, and our services mainly are at home. So we bring the hospital to your house. We're able to bring all the services: nutrition, physio, lab tests, medication delivery. The only thing we're not able to do is X-rays and surgery. Otherwise, the rest can be done from the house at the comfort of your home. I lead the team, but we are a big team as well. So next. Yeah, that's me. As mentioned, I can go to the next one. Yeah, and those are our services. As I had mentioned, you can go to the next one. So we'll go straight on to the topic of the day, which is COVID-19. Just as I mentioned, we are looking at what we already know. So this is just a brief reminder. COVID-19 is a condition that was identified first in Wuhan, China. That was in 2019, and that's where the name actually comes from. This is information you already have. The spread has not changed. Still a disease that is spread through droplets or touching surfaces that are um, already have the virus. The other way, it's either someone sneezes and that's if those droplets actually get to your nose, or when they cough, then you get a disease. So this has not changed. This remains the same. And one of the risk factors, as we keep saying, for people who are in offices is the high touch surfaces, including the doorknobs, um, the microwave in the tea room. And now what we encourage people is actually to bring their own tea to the office instead of having to share uh, back in the office. So that has not changed even with the new variant, as you will see. The spread is still the same. And even the prevention is wearing of masks, washing hands, sanitizing. And now we are talking about more vaccination because it's one of the ways of reducing the spread of the disease, but making sure you're keeping the social distance as been mentioned. So nothing much has changed in terms of all this. When you look at the signs and symptoms, it's still the same. The main majority of the people will have symptoms that are related to what may look like a cold. So having a running nose, nasal congestion, sore throat, dry cough, chest pain. Some people get difficulty in breathing, and depending on the severity, they may require oxygen and admission in hospital. So, however, we also seen some more symptoms that have come up. You hear people saying they've lost their sense of taste and sense of smell. Now, people with abdominal pain and diarrhea, a lot of them are also testing positive for COVID-19. So it's become now a routine test for people who go to hospital and we make sure that they get a COVID test in addition to other tests that are going to take place. In terms of classification, this has not changed as well. We have those who are asymptomatic and mild, making the majority of the people with COVID-19. So these are people who test positive but do not have any symptoms, do not have any signs. For those with mild, they'll now have just the mild symptoms that resemble a cold. So running nose, nasal congestion. And most of these people will actually buy over-the-counter medication and get better. The people with now moderate and severe are the people now who develop difficulty in breathing, requiring oxygen supplementation. So either at home or in the hospital. These are also people who have start developing organ failure. So they'll require their organs to be supported. If it's the lungs that are failed, then they'll require to be on a ventilator, either using what is known as non-invasive, that's using a big mask, or using being intubated, that's putting a tube through their throat for them to be assisted with breathing. If there are other organs like the kidneys which are failed, they go for dialysis. The difference between who gets what condition depends on, one, their age. So the older population are at higher risk. So anyone above 50, whether male or female, becomes a high risk for getting a severe form of the disease. People with underlying conditions such as diabetes, hypertension, chronic lung disease, like COPD or chronic obstructive pulmonary disease, patients with asthma, people who have chronic kidney disease. Those are patients who are already on dialysis, their kidneys are failed. People with HIV and AIDS, patients with also cancer. All these patients with any underlying condition, then they become a higher risk. for getting severe disease and getting admitted, and more so if they're not vaccinated. So vaccination now becomes also one of the independent risk factors. So you are seeing a lot of people getting admitted with severe COVID are people who are not vaccinated. And I must add that also pregnancy is becoming a risk factor. So for people who are pregnant, the risk is also high. Or people who've just delivered and are breastfeeding, the risk, we're seeing them, especially now with the Delta variant. A lot of them are getting admitted and some are succumbing to the disease, just mainly because pregnancy by itself is reduces the immunity. So it's important even for the pregnant women to also get vaccinated, as we'll see. So that's what we already know. In terms of treatment, is mainly symptomatic, managing the symptoms as they present. So if you have a cold, you be given some paracetamol, something to take care of the fever. If you have one, if you have a blocked nose, then you get the antihistamines. If you're having difficulty in breathing and the oxygen levels are low, then you'll get the oxygen therapy. We also have new drugs that have come up in the market. Some are very expensive, what are called immunomodulators. You may have been asked by your doctors to maybe buy for relatives. So those are just medication to try and help your immunity and help your body fight the disease. One is tocilizumab, another one is remdesivir. So these are words you start hearing coming up, especially now with the new disease. So in case any of this happens, this is already information we already have. Moving on is now what we have and what is known as long COVID. So people who've recovered from COVID disease, especially people with moderate and severe disease, they're developing symptoms that continue for a period of up to 6 months in some of the people. So you'd find people getting shortness of breath. They get this what is known as cognitive dysfunction or clouding. Uh, they'll feel like there's something actually sitting on their head. That's how they describe it. They'll get this fatigue. They're always tired. So, and all these are symptoms of what is known as long COVID. Some may have a persistent cough that may continue for some time. Some may have chest pains, anxiety, depression. So in case anyone develops any of these symptoms, then you need to know that they are getting what is known as long COVID. We've seen some of the patients actually end up with dependence on oxygen for a long time, for up to more than 3 months, where they are now on home oxygen. And then the time they take off the oxygen, they get worse, some of them requiring to be readmitted. So it's important for us to understand this condition and to know the implication that it may have on one person, on one they get it. Next. So we look at the variants and we'll see why it's important. So usually what happens with viruses, they keep changing their form, and they do this mainly to survive. So you'll find for a virus that is spreading a lot among people, then every time it spreads, it has that risk of changing its format, and that's how we get the variant. So there are various variants that have been identified, and they're classified into 3 groups. We look at them. There are those that we call variants of concern. This is the alpha, beta, delta, and gamma. The important one right now has been the delta, though right now we are coming out of it. I was just looking at the statistics yesterday, and we had a positivity rate of about 2%. So, which is a good thing, meaning that people have either gotten infected and have overcome. Some, unfortunately, some have succumbed to it, but currently things are under control when we talk about the delta. What we have is also, so delta is the one that actually came from India. Beta was one that came from South Africa. That was the strain. And then we have the alpha, which was mainly seen in Brazil and Japan. But now we also have the gamma, which people are fearing that could give another wave. So, but it's under watch, and we're trying to see and making sure that it will not give us another wave. So we can move on. So the characteristics of these variants is that, as I said, It's just a way of survival of these viruses. So by them changing their form, then they have what is known as, they get an increase in transmissibility. So you find these variants, they're able to spread more frequently and faster to different people. They tend to cause a more severe disease. So recently there were so many hospital admissions with hospital beds being full. So this is something that happens a lot. So the other thing that happens is for people who've been infected before, in case they get now infected with a new variant, we find it's the antibodies that they had are not effective. So it's important for us to think about that. Then when you're looking about testing, you find we tend to get a lot of what are known as false negatives. And this is because the testing techniques are no longer maybe effective. So you get what is known as diagnostic detection failure. So they're ineffective in a way that you need to develop new testing ways as the variants continue developing. When you look at the treatments, some of the treatments that have already been established no longer work. Then when you're looking at in terms of vaccines, as the variants keep changing, then it gets to a point where some of them may actually may not be possible to, may not be effective. And this is one of the things that is monitored very closely among the viruses. So you'll see CDC, WHO, and other organizations making sure that they are following to see if there's any of the variants that are becoming resistant to the current vaccines. So you can go to the next one. So when looking at Delta specifically, as I said, it's one which was identified in India, and it was causing the current wave that has just ended. One thing that I must say is it was causing more, it was more infectious in people who are not vaccinated. And the vaccine was shown to be protective. So you'll find in majority of the people who are getting admitted, more than 95% of them are people who are not vaccinated. And actually 100% of the people who ended up in ICU and died from it had not received the vaccine. And these are stories out there you'll hear, people saying they asked for their friends to go for vaccination. Some declined, and unfortunately they succumbed to the virus. Next. So it's very important for us to get vaccinated when we get the opportunity. The other variants are what are known as variants of interest. These are variants that are on the watch, but nobody they've not been shown to cause any severe illness or anything that is worrisome. But they're just variants of interest. We also have what are known as the variants of high consequence. The good thing is none of the variants is at this stage. These variants are the ones I was talking about, that none of the treatment seems to work with them, or even the vaccines that have been developed are not effective. So none of the variants that are currently circulating have gotten to this level of where they're becoming variants of high variants. Then a lot of people will die from this virus. Next. So those are the variants. I want us now to go to the main topic of today. We're just looking at just some little bit about what we already know about the viruses. So looking at vaccines, as I keep saying, vaccination is not something which is new. It's something that has been there for a long time. We usually take our children to get vaccinated, and most of them, by the time they're 5, they've already received all their vaccines. Actually, majority of the vaccines will be given in the first year. So vaccination is not something which is new. And the same companies that have actually been making vaccines over the time are the same ones that are making these COVID vaccines. So we need to have trust. We need to believe that they have our best interest at heart. And I know there are various people who've had stories and misinformation about the fact that someone wants to finish the blacks and all that. But none of that is true. And we look at this briefly. So as I said, vaccination is a simple and safe and effective way of protecting people against harmful diseases before they come into contact with them. So if you are to think about it, it's like being in an army. You do all the drills, you prepare for the actual war. So that's what vaccination does. It just prepares your body defense mechanism, make sure that it's ready anytime it gets attacked by the virus. In this case, if that's what your body has been trained, if that's what you are getting the vaccination for, then it means your body will fight the infection and kill it. And that's what vaccines actually do. They just use your natural defense mechanism to get ready and build it up before the actual infection comes. Next. So, and what usually we are aiming for is what is known as, you can go to the next one, is known as, next. So is known as herd immunity. So we are looking for herd immunity. And by herd immunity, we mean that you want a majority of the people to get vaccinated. Usually the target population is about at least 70%. We are still very low in terms of vaccination. Of the number of people who are fully vaccinated in the country, we are less than 2%. So that's still a very low figure as compared to where we'd want it to be. But we're hoping as more and more people receive the vaccines, especially the 2 doses, then this level will keep going. And the importance of herd immunity is that you find if you introduce a new disease in a community that is not immunized or has not been exposed to the disease before, a majority of the people will either, especially those who are vulnerable, they're likely to die from it. So that's why we introduce immunization. And what it does is introduces it before at a smaller dose, non-infectious dose. And once that happens, then when the community is introduced to the disease, to the actual disease, then only a few of the people, even those who are vulnerable, will actually succumb to the disease. And that's what we actually aim for when you're doing herd immunity. And next, and we've managed to attain herd immunity with various vaccines. So a good example is the ones I was talking about, the ones that are mainly given in children. Maybe to talk about one specific one is the rotavirus. For those who may be familiar with hospitals, in a few years, a lot of children were dying from diarrhea diseases. That's from rotavirus, which causes diarrhea in children. And since the introduction of the rotavirus, we are seeing very few children who are actually succumbing to diarrhea. Most of them will get diarrhea from other diseases, but not rotavirus, which before was causing a lot of havoc in children. So, and this is one of the vaccines that have been shown to be very effective in recent years. One thing I must say, when you look at the efficacy of it, it's about 50%. And yet, when you look at how much it has saved, it's actually most children now are getting to their 5th birthday. Next. So it's very important for us to, as much as we look at the various vaccines and their efficacy, it's important that we know that the best vaccine is the one which you have in the body. So when you're looking at how vaccines are made, there are several ways that that vaccines are made. There are about 5 types. So we have what are known as the live weakened pathogens. So you take the virus itself, make it weak, and then now make a vaccine out of it. The other alternative is to kill the organism or the pathogen and make what is known as a live vaccine. We also sometimes take a particle of the part of the organism or the pathogen, and that becomes a particle vaccine. We also have what are known as the genetic, or the ones that use the genetic material of the pathogen, that's the RNA and DNA. And looking at the ones we are discussing today, mostly the Moderna. Moderna is mainly, this is what is known as the messenger RNA. And messenger RNA just means, just to differentiate it, the humans have what is known as the DNA, so which is very different from RNA. And usually what happens, anytime you get the Moderna vaccine, it gets into your body and it releases the particles, and introduces the immunity. So by so doing, the RNA is actually killed immediately in the body. It doesn't integrate to your DNA, so it doesn't affect your body in any way. And it's very important for us to know, as much as we talk about them being genetic, it doesn't change your genetic makeup as a human being. We also have what are known as the ones that use the delivery vehicle. These are now the others, the Johnson and Johnson. We also have here the AstraZeneca. All these are viruses that are vaccines that are using the vectored. They are known as the vectored vaccine, and the most common one that is what you're having is the AstraZeneca, and now the Johnson and Johnson. Next, so the Pfizer is also a messenger RNA, and it's important for us to know that. So, as mentioned, those are still the same vaccines, and this is what I was talking about. So the RNA gets destroyed shortly after vaccination. It doesn't get to your cell nucleus, so it doesn't integrate into your human DNA, and that means it cannot change anything in your body. So as much as we may think that the Moderna may have an effect on our DNA, it doesn't, because it's a messenger RNA, which is different from the DNA that we have as humans. Next. So those are the various forms, as mentioned. Next. So before we get vaccines, and before they're introduced to the humans, they go through what is known as testing. We have what is known as the preclinical testing and the clinical one, or the preclinical trial. This is where it's tested in the lab using animals. So you want to find out if any of these vaccines are actually effective, but outside the lab, not before they're brought into humans. Then once they're introduced to human beings, we go now to what is known as the clinical phase. And the clinical trials are divided into 4. We have what is known as phase 1. This is where you just want to find out whether the vaccine is safe. And you use a small number of people, less than 100. And the reason is you don't want to use a large population in case the vaccine becomes toxic or is causing deaths in humans. Then the next thing you want to find out is whether it's producing an immune response and what is the best dose. So you'll take about 100 to 1,000 people and see what's the best dose that you're going to give to human beings. So you'll find that by the time they're coming up with a dose of 0.5 ml, this is something that they've tested and it's been shown to produce an immune response. The third phase usually is where now you want to see whether the immune response is protective. And these are what are also known as the efficacy trial. So when you see them talking about different vaccines having different efficacy before being given, this is what they're talking about, that it has gone through phase 3, and this is the percentage that it was found to be effective against the specific virus. So this will usually use a larger group of people, more than 1,000. Then once you've managed to get this data and it's been approved, then now you go to phase 4. Phase 4 is where all the vaccines currently being given are. And at this phase, we are just trying to do what is known as post-marketing surveillance. So you'll find we start now looking at different vaccines when you get them.
Hello, Dr. We've lost you.
Hope you can hear me.
Yes, we can hear you now. Proceed.
So, sorry, I was talking about is where you now bring in the vaccine and put it, you want to test how it's working well in the population, and this is after it's been approved for you. In terms of what are there any other side effects that are coming out of this vaccines that are not there initially. And a good example is some people have reported
Dr. Jeremy, lost you again. Can you hear us, Dr.?
Can you hear
Apologies.
me?
Yes, now we can hear you, Dr.
Sorry, I'm not sure what happened. Apologies for that. I was just talking about the various the stage 4. So phase 4. I was saying that's where we are as with most vaccines, and we are trying to see how well they are working during now this phase 4 of the post-marketing surveillance. One example of some of the side effects, as I was mentioning, which was not initially documented, was the issue of affecting the menstrual. It's something that now we are looking at and seeing as one of the things that we need to add to the side effects of the vaccine. Next. Hello, can you go to the next slide?
Okay.
Yeah, so that's still the same. Yeah, so we look at the current approved vaccines that we have in the market. So there are various types. So there are those which are called the messenger RNA vaccines. That's the Moderna and Pfizer. These are vaccines that are mainly produced in the US, and now they're available locally. Moderna is the new one. We've had before the Oxford AstraZeneca one. We've also had the Sputnik before. It's no longer available. We also have now the Johnson & Johnson currently in the country.
Dr. we have lost you again. Dr. Jeremy? Dr. Jeremy, are you there?
Yeah, I'm there.
Oh, sorry, seem to have lost you a bit.
Can you hear me now?
Yes, now we can hear you. Please proceed.
You can hear me? So I was talking about the current vaccines that we have, the Moderna and Pfizer. Those are the messenger RNA vaccines. Next, please. Then we have the AstraZeneca. We also have the Sinovac. This one is not currently in Kenya. Sorry, the previous one. Sorry, go back a bit. The other one? Yeah, that one. So I was talking about these vaccines that have been approved. So Moderna and Pfizer are the messenger RNA vaccines. AstraZeneca and Johnson are the ones that I talked about, the vectored vaccines. Then we also have the Sputnik and the Sinovac. The only difference is you'll realize all these vaccines are given as 2 doses, apart from the Johnson and Johnson, where you get 1 dose, and 1 dose has been shown to be effective in protecting and offering the necessary protection against the vaccine. So next. So the question we keep asking is, are these vaccines safe? And we look at some of the side effects that we see when it comes to vaccination. Next. So as I mentioned, when you're looking at the vaccines, is that by the time you get a vaccine, one, it does not prevent one from contracting the virus, as I said. So you'll still get the virus, but when you get the virus, your body is already trained to fight the infection. So it will prevent your body from actually succumbing or getting a severe form of the disease, because it's not a new disease in your body system. So the immunity is already there and you're able to fight it. The other thing is that, as I said, it prevents severe disease and hospitalization. One more thing that we are seeing is that the vaccines actually are reducing the transmissions. So people who are vaccinated, since they're able to clear the vaccine very fast, that means the time the vaccine is circulating is reduced, and that way you're able to reduce the number of transmissions that are occurring. Next. Yeah, so when you look at who is eligible to get the vaccine, the first thing is anyone above 18 years, and priority is given to those with comorbidities, that is either diabetes, hypertension, asthma, COPD, any underlying disease that they may have. These are people who usually are given priority, but right now, if you just go to any facility and you're above 18, you'll actually get the vaccine. The reason why it's not given in children is because it's not been tested in people less than 18 years. So there's no, if you're a child and less than 18, then it's not recommended for you to get the vaccine. We are hoping moving forward, people can actually get the vaccine to even children, so that then they can have a long-term effect. The only challenge is at the moment, we don't know how long the immunity will last. What we're likely to see is we get to a scenario similar to what we're seeing with the flu vaccine. People get a shot every year of the COVID vaccine, but we have not yet reached there. We'll wait and be told about that, but that's a likely thing, mainly because of the variants that keep coming up. We're not sure whether the vaccine will be protective for long enough. The other condition is that you must be asymptomatic. That means you're not supposed to have any symptoms. You're supposed to no fever, no cough, no shortness of breath. You're supposed to be healthy by the time you're getting the vaccine. In terms of COVID positive, if you've tested positive, you're not supposed to get the vaccine immediately. The current recommendation is you give it at least a month after recovery, but don't wait more than 3 months. Reason being, the antibodies that are produced actually will last most of the time up to 3 months. And now with the new variants, the antibodies are not protective, so you need to get the vaccine as soon as the symptoms are resolved and as soon as you feel much better. For people who are pregnant, we're recommending for one to get the vaccine, especially in the second trimester and that trimester. Unfortunately, we are seeing so many mothers right now getting severe form of the disease, and some have unfortunately succumbed to it. So if you're pregnant and in the second trimester or that trimester, go for the vaccine. It's been shown to be safe. And this has actually been given as a statement from the Kenya Obstetrics and Gynecologic Society. They've said it's okay to get the vaccine, and this is the same information from the World Health Organization. So get the vaccine if you're pregnant. It's more risky to be without the vaccine than to get it. If you have any underlying condition, you actually a priority. So some people have feared to get the vaccine because they have underlying condition. Remember, this is the main reason why vaccines were developed for COVID. It's mainly to protect people with underlying conditions. So if you have any of these risk conditions, risk that will put you to getting a severe disease, then you need to go ahead and get the vaccine. Next. Next slide. So this is a table that compares the different vaccines that are currently available. One thing that I must say is, as I keep saying, is the best vaccine is the one that actually you've received. So if you get any of these vaccines, just know that you're protected. And looking at, so that's what usually we are looking at. Have you received any of the vaccines? And it's actually protective. Anything above 90% in terms of effectiveness is good to protect you. So the AstraZeneca, which has been there now with us since March, is now almost 6 months. It's usually given two doses, and we usually recommend from 4 weeks to 12 weeks. So this is what we've been getting. The country chose 12 weeks. And in terms of effectiveness, it was about 62%. If you get the 2 doses, that's 90%. When you look at Moderna, which is a messenger RNA, they are saying the effectiveness is about 28%, 95%. The recommendation is you get it 4 weeks apart. So it's a messenger RNA, and as I mentioned earlier, is the RNA does not integrate to your human DNA. The same thing with the Pfizer one. Pfizer one is also given 3 weeks apart, also quite effective. A lot of pregnant women are going for the Moderna, and that's the choice. The others work as well, so it's important for us to know that. The other one which we have is the Johnson & Johnson, which is similar to the AstraZeneca. It's a particle vaccine, which uses the same thing as the AstraZeneca, which is the adenovirus. It's usually given as a single dose. And when you look at in terms of protection against moderate to severe dose disease, then it's about 72%. The difference between the various vaccines comes also in terms of storage. So you'll find for the Moderna and Pfizer, they require very special storage, refrigeration storage. So -20 for the Moderna and -70. So it's not a very popular vaccine, mainly because of the storage requirements that are required. But thankfully, right now, we're able to store them and distribute them in the country. So right now it's not a big problem as it was before. The rest are usually stored between 2 to 8 degrees centigrade, and has been shown to be effective for all the vaccines. Next. So the way they're administered, so you'll find they are all given as an intramuscular injection, usually on the upper outer quadrant of the deltoid muscle. That's on your muscle on the left side. It's a small dose of 0.5 mL. And as I mentioned, you'll find other than the Johnson & Johnson, all the rest are given as 2 doses. Depending on which one you get, it's 2 doses. In case someone got one vaccine, for example, if you got AstraZeneca, we're recommending that you get the same one for the second dose. However, if you get AstraZeneca and you travel to another country and they're giving a different vaccine, we say you wait at least for 14 days and you can restart now the new vaccine that is available. So we discourage people from changing from one vaccine, especially in the same country. And the reason being is, remember I talked about herd immunity. We want as many people as possible to get the vaccine. I know there are people who are fully vaccinated and they would like to get another vaccine on top, but it's not usually recommended. If you just get one vaccine, that's protective enough. You don't need a second one. So it's important for us to know that. So next, in terms of the side effects, so most vaccines, these vaccines interestingly have similar side effects. Most of them will be local. Can go to the next slide. They're local side effects. So you find at the injection sites, some people complain of pain, some will develop swelling, they may get redness at that area. Then we have what seems like flu-like symptoms. So someone may get a mild fever, headache, feel tired, muscle pain, and joint pains. These will usually last for a period of up to less than a week. And what we say, in case you get people with more than a week of these symptoms, it's important that they go back to the place where they got the vaccination. One thing that I must mention is once you get the vaccine, it gives you have up to 2 weeks before they're effective. So it doesn't start protecting you immediately. You have about 2 weeks. So it's important that you continue to take care of yourself. Make sure you're not breaking the rules of COVID. That's washing your hands, maintaining social distance, wearing your mask, because you're still not protective until 2 weeks are over. And what we've seen is some people actually get infected during the 2 weeks, and some people think they got it from the vaccine. But as I mentioned, you do not get infection from the vaccine because it's been tested and it's been shown not to cause disease. So it's not from the vaccine, but from an actual infection because you're not protected for about 2 weeks. Next. We also have these rare side effects. One of them is the anaphylaxis or the severe allergic reaction. So before it was thought that the vaccines contained eggs and all that, but none of them actually has those products. So if you're allergic to eggs or you're allergic to meat, then you can still get the vaccine because the vaccine does not have any of those animal products and it's safe. One thing that we recommend is immediately you get the vaccine, just give it about at least stay in the facility for 30 minutes so that they're able to monitor and see if you're developing any allergic reaction. We've had people develop clots from vaccination. However, the risk is very low. Just to compare these with the people who get COVID, if you get COVID, your risk is about 16 times more. So if you have COVID, the risk of getting a blood clot is 16 times higher, actually 16.7. But if you get the vaccine, your risk is very low. It's actually 1 in 7 million people are the ones who get the clot. So they are very rare. And the good thing is we are aware about that. So we always watching in case you develop any symptoms and you're able to get managed for that. I must say, since we started vaccination in the country, none of the people who've gotten the vaccines have gotten any clot or none that has been reported to have a severe allergic reaction. So these vaccines are safe. The best thing is, I would say, if you have to choose a vaccine, get the one that is readily available. If it's Moderna, which you have access to, go for it. If it's AstraZeneca, go for it, because any vaccine that has a protection above 50% is equally effective. So, and all these vaccines are equally effective. So we don't need to worry so much about which one you're getting. They're all conferring protection, and we've seen them actually save lives of many people. There are people who, if they were not vaccinated, they'll actually have succumbed to the disease. I think I want to stop there so that now we can take in questions. Those are the references for people who may want to go and read more.
Thank you so much, Diktari, for that very informative update. I'd like to go straight to the questions in the chat box. The first question is from Dominic Sikuku. Dominic asks, does anyone need to be tested before being vaccinated?
No, you don't need any testing. So the most important thing is you must be asymptomatic. So not unless you've tested positive, but for those who've not tested, you don't need to do a test before you get vaccinated.
Thank you, Daktari. The second question is from Patrick Mwangi, and he asks you to reconfirm on which vaccine is affecting the menstrual cycle.
So this is data that is still being collected, and I was saying during phase 4, we've had people complain that it's affecting them. This was mostly when we were getting the AstraZeneca initially. So it's something that is still under our close observation to see whether it's an actual side effect of the vaccine, but it was AstraZeneca when it came in initially. That a few of the women started complaining that it's affecting their menstrual cycle. Just to add, none of the vaccines actually affects fertility. I know we've had also such rumors, and they're also not true.
Thank you. Anne Wanjohi asks, if my first dose was AstraZeneca, can my next dose be Pfizer?
As I said, if you got AstraZeneca as your first dose, then you're in Kenya. Can you hear me?
Yes, yes.
So I was saying, if you got AstraZeneca as your first dose, then we recommend you get the same one as a second dose. And it's not, this doesn't mean that it won't work. It just means that you're giving someone else a chance instead of taking their dose of the Pfizer, because you already got AstraZeneca, got the second dose as AstraZeneca as well. However, there is no effect or it won't affect you in any way if you get the Pfizer as a second dose.
All right, thank you. Anthony Kibe asks, what happens if the conditions for storage are not met? Does it render the vaccine ineffective?
Yes, it does. So, and that's why if you look at the vaccination, we're usually very strict on maintaining what is known as the cold chain. So you'll see the vaccines, if it's the AstraZeneca one and the Johnson & Johnson, they have to be stored at 2 to 8 degrees centigrade. And this is monitored and recorded daily. Because if you don't store it in the correct temperatures, then remember these are vaccines, we call them, they are live. So you're likely to kill the active or the active ingredient in them. So that means if they're not stored properly, they can easily get destroyed. And that means they will not be effective. So we are very cautious about the temperatures. And looking at, for example, the Pfizer and Moderna, their temperatures are even more strict. So all the way to minus 90 and minus 70. So we are very strict in terms of storage so that it doesn't become ineffective.
Asante. The next question is from Kathleen Kagure, and she asks, what if I had COVID and I still have ongoing complications like developing clots? What does she do?
So for someone who has clots, what we recommend is they need to discuss with their physician whether one, if they're already on treatment, that means but they need to discuss very closely with their physician who's taking care of their clots. It doesn't mean that once you get the vaccine, the clots form will be different from the ones you had. And it means if you're already on treatment, then it's fine, you can get the vaccination. As I said, the risk is very low of getting clots from vaccination.
Thank you, Daktari. John Courier asks, what is the connection between magnetism and the vaccine? Is it something that one needs to be worried about?
I'm not sure I understand what is meant by magnetism, but it's not something I've come across, so I'm not able to respond to that now. Maybe I can respond to it in writing later after I do some, try and find out. But I haven't heard of magnetism and effects on the vaccine.
Okay, thank you. Maybe, John, you can chat us your email address, and when Daktari has more information, he will answer that question directly. The next question is from Doreen Wairimo, and she's asking for clarification of the difference between the vaccine that is delivered by DNA and those that are delivered under RNA.
So we only have messenger RNA vaccines. We do not have any that contain DNA. And this is mainly the Moderna and the Pfizer. So usually what happens is immediately the vaccine gets into the body, the messenger RNA gets destroyed, and that's it. And then it's able to introduce now the immune response. That is the desired effect. So it doesn't affect your DNA as a human being. So we do not have DNA vaccines.
Thank you for that clarification. Frida Wanja asked the next question, and she asks, is the vaccination for lifetime, or will there be a need for repeat vaccination? For example, annual vaccination.
As I said, this is a likelihood, and mainly because of the way we see the variants coming up. So I can't say we won't have this being a reality. We'll just comparing it to the flu vaccine, we're likely to be getting the COVID shots every year based on how the variants develop. So plus we don't know for how long the infection, the booster doses every year. So that's my thinking, and that's what we think most people. So we are only waiting and seeing what will happen next year.
Okay, thank you. Jennifer Osia asks, what should one do if the flu-like symptoms do not go away and have led to flaring up of sinuses?
So if this happens after vaccination, what we usually recommend is just go back to the place you got the vaccine and have the medics look at you and also document this. Because as I said, we're documenting all these side effects and then submitting them to a central place where we are continuously updating the data on vaccines. So and that will include now the treatment of the flu-like symptoms, and also trying to find out if there's any other cause for this. So I would recommend you go back to where you got the vaccination to give them the feedback.
Okay. The next question is from Abila William John, and he asks, how many years will the vaccination last before one needs another vaccination?
I think I mentioned we don't know yet, because these are still new vaccines. They are still being studied in terms of the duration of how long the effective will last. So we don't know. We just wait and you're following closely to see what the recommendation will be. So we don't know yet.
Okay. Caroline Gashanja asks the next questions, and she asks, what if one unknowingly is vaccinated while COVID positive? Will the vaccine still be effective?
Yes, the vaccines will still be effective. Remember, they train your body to fight the infection. So what it does, it prevents future infections. There may be a small risk, especially if you had symptoms, that the vaccine would worsen the symptoms. So, but if you're asymptomatic, there's been shown not to be no effect on your symptoms, but they're still effective even if you're positive and you're asymptomatic.
All right, thank you. Ruben Mashara asked the next question. Do vaccines affect performance? And I assume here he means sexual performance.
There's no relation between evidence that there's any effect.
All right, thank you. We have another question from John Courier, and he asks, which type of vaccine is best for someone who has chronic hypertension?
All the vaccines are safe and effective. Remember, as I said, these are vaccines that have been developed for people with these underlying conditions. So I would say you get the one that you have access to. They're all effective.
Asante Daktari. Anthony asks for clarification between the difference between the RNA vaccine and the particle vaccine.
So this is more of the science in how they are made. So you'll find some of the vaccines will take a small part. It doesn't have to be the genetic part of the vaccine, but it's a small part of the pathogen, and that is what is used to make the vaccine. However, the RNA use the genetic material, so they are very specific. They use just the genetic material, so that's the difference. So the particle can be any part of it doesn't have to be the genetic material of the pathogen, and that's the difference.
Thank you for that clarification. Isabel Gitu asks the next question, which is, which facilities have the Johnson dose? I assume she's asking for the vaccination centers that you may know offer the J&J vaccine.
I know one of the, it was Kenyatta National Hospital, Bagadi they had the vaccine, the Johnson & Johnson. That's the main one where I was sure they had it. I don't know any other facilities that are currently giving it. I remember these only were a few doses that came into the country.
Asante. And our final question is from Margaret Kamau, and she asks, after how long should one wait? Should one get the vaccination after recovery? And I assume she means that is after recovery from COVID-19.
Yeah, so the first thing is one must be asymptomatic, meaning the cough, the chest pain, the difficulty in breathing, the fevers have all gone away. And then usually we say give it about a month to allow for this full recovery, but don't wait more than 3 months. So any time between the first and third month after recovery, then that's a good time to get the vaccine.
Asante sana, that was the final question. Daktari, I don't know if you'd like to share your contact on how the participants can reach you in case they need further follow-up on the presentation.
Sure, I can type in my number there, but it's also in the presentation we're going to share with them.
Yes. Okay, as Daktari types in his phone number and how you can reach him, I would like to thank all the participants.
I'll share my number.
Thank you for taking your time to log in and being interactive in the Q&A question. Apologies, I see one final question from Samuel. I believe we have time to answer, Daktari, to answer you before we end the session. Samuel asked, how about acceptability of vaccine that is vis-a-vis the international travel? He notes that not all vaccines are accepted by the embassies. Would you have a comment on that, Daktari?
So, yes, so this is something that has been actually appealed, because you remember, I think it was the UK and other European countries saying they will not accept vaccines that have been given to the Africans, and yet they're the same ones they're getting. So this is currently being appealed, and we believe that as long as you've been fully vaccinated and you've gotten your whichever vaccine, either the Pfizer, Moderna, or the AstraZeneca, which are currently available, then you should be excluded from the quarantine.
Thank you, Daktari. Again, participants, we truly
appreciate the mandatory quarantine that you get when you visit is appeal.
Oh, sorry. I think there was a delay on the final part of the answer. As I was saying, asanteni sana. Thank you for participation. We truly appreciate your time and your participation, especially on the Q&A. To all participants, Daktari, we appreciate that you've taken time to enlighten us on what we need to know as we continue to combat this COVID-19 pandemic. I would also like to extend a massive thank you to the Britam team that helped to plan this, the social media and IT team, and all this, on top of all this, appreciate the one who led the team, David Obonyo, who is the head of Britam Health. And please take note of Daktari's phone number and email address on the chat box. Have a lovely afternoon and the rest of the week. Thank you.